You are over 60. Stop walking for a moment, because what I'm about to share may surprise you. Many people believe walking is the best exercise after 60. Doctors recommend it. Friends swear by it. But here's the truth most seniors never hear. There is one simple chair exercise that can be more effective than walking, especially for strength, balance, joint protection, and long-term independence. And yes, this is surgeon approved. If walking hurts your knees, if you feel tired quickly, if you're scared of falling, or if you've already slowed down after 60, this message is for you. Because this one chair exercise targets the exact muscles that keep you standing, climbing stairs, getting out of bed, and living independently. Many seniors who do this daily report stronger legs, better balance, less joint pain, and more confidence than walking alone ever gave them. And the best part, you can do it right now, at home, without special equipment, without sweating, and without putting stress on your joints. Let's begin. As we age, muscle loss becomes the silent danger. After 60, adults can lose up to 1–2% of muscle mass every year if they don't train strength. Walking is excellent for the heart, yes, but walking does not effectively strengthen the muscles that prevent falls. It doesn't fully activate your glutes, thighs, hips, or core, the muscles that surgeons and physical therapists focus on when helping seniors recover mobility. That's why many orthopedic surgeons and geriatric specialists now say this: strength before steps. This is where the chair exercise comes in. Chair sit to stand exercise. This single movement is often called the functional strength king for seniors. Surgeons love it because it mimics real life. Every time you stand up from a chair, couch, or toilet, you are performing this movement. If you can do this exercise well, you can live independently longer. Sit tall on a sturdy chair. Your feet should be flat on the floor, hip width apart. Scoot slightly forward so your back is not resting against the chair. Keep your chest lifted and shoulders relaxed. Now, lean slightly forward from your hips, not your lower back. Press your feet firmly into the floor. Slowly stand up using your legs, not your hands. Once you're standing tall, pause for 1 second. Then slowly lower yourself back down into the chair with control. That's 1 repetition. This movement activates your quadriceps, hamstrings, glutes, calves, core, and even your posture muscles, all at once. Walking does not do this. In fact, walking often avoids weak muscles, while this exercise forces them to wake up and grow stronger. Start with 5 repetitions. If that feels easy, aim for 10. Over time, many seniors work up to 15 or even 20 repetitions, which dramatically improves leg strength. Now here's why this exercise can be better than walking for many people over 60. First, joint safety. Walking, especially on hard surfaces, can irritate knees, hips, and lower back. This exercise allows you to control the movement, the speed, and the range. No pounding, no uneven ground. Second, fall prevention. Most falls happen when standing up, sitting down, or changing direction, not while walking straight. This exercise trains exactly those transitions. Third, bone strength. Standing up against gravity loads the bones safely. This signals your body to maintain bone density, which is critical for preventing fractures. Fourth, confidence. When you know you can stand up easily without using your hands, your confidence skyrockets. Confidence reduces fear. Fear reduces falls. But there's a secret that surgeons often share with patients, and this is important. The slow lowering phase is where the magic happens. When you lower yourself back into the chair slowly, taking 3 to 5 seconds, you are building eccentric strength. This is the kind of strength that protects joints, absorbs shock, and prevents sudden collapses. So don't drop into the chair. Control it. Now, let's make this even more powerful, without making it harder. Breathe in as you prepare. Breathe out as you stand. Breathe in again at the top. Slowly breathe out as you sit. Breathing properly keeps blood pressure stable and prevents dizziness. If you have knee pain, here's a surgeon-approved modification. Place a cushion on the chair to reduce depth. This decreases knee stress while still strengthening the muscles. If balance is a concern, place the chair near a wall or table. You can lightly touch it for support, but try not to push with your hands. Now let's talk about frequency. Walking is often done daily, but it doesn't rebuild lost muscle. This exercise can. Do this exercise once or twice per day, especially in the morning or early afternoon. Even 5 minutes can change how your body feels. Many seniors notice improvements in just 2 weeks. Better posture, less knee pain, easier stair climbing, more energy. Now here's something most people don't realize. If you can't stand up easily, walking becomes risky. That's why surgeons prioritize this movement after surgery, illness, or injury. They don't say, go walk 5 miles. They say, can you stand up safely? Walking without strength is like driving a car with weak brakes. This one chair exercise builds the brakes. Now let's take it one step further, optional, but powerful. Chair sit to stand hold. Once you stand up, instead of sitting right back down, hold the standing position for 5 to 10 seconds. Stand tall, tighten your thighs and glutes gently. Keep breathing, then sit back down slowly. This improves balance, posture, and endurance, something walking alone often fails to do. You don't need to do this every time. Just add it to 2 or 3 repetitions. Now let's talk motivation, because consistency matters more than intensity. You don't need fancy shoes. You don't need a gym. You don't even need to change clothes. All you need is a chair and commitment. Many seniors quit walking because of weather, pain, or fear of falling. This exercise removes those barriers. That's why it's often more sustainable than walking. And no, you don't have to stop walking completely. Walking is still good for circulation and mood. But if you must choose one movement that protects independence, surgeons and physical therapists increasingly choose this chair exercise. Here's a powerful mindset shift. Don't exercise to burn calories. Exercise to stay independent. Standing up without help at 70, 80, or even 90 years old, that's real fitness. If you're watching this and thinking, I'm too weak, remember this. Weakness improves with use. Avoidance makes it worse. Start small. 1 repetition is better than none. And if today you can only stand halfway, that's okay. Your muscles will adapt. Your body is not fragile. It is responsive. This chair exercise sends a clear message to your body. We still need strength. And your body listens. So today, before your next walk, before sitting for hours, before thinking it's too late, stand up. Slowly, with control, then sit back down with pride. That single movement may do more for your health than miles of walking ever could. If you're
Vitamin
over
D
60,
deficiency is
this is how
incredibly
you stay
common,
strong.
especially in urban areas.